Welcome. We thank you for joining us as the Above the Influence Wellness Coalition starts this new web series where we want to take different topics of wellness and spend a little time just having a conversation about it and educating and inspiring the community through, again, these conversations. So we thank you for being here with us today. We have with us Emily Parker, and she is a prevention specialist with the Area Substance Abuse Council, better known as ASAC, if that's how you know it. And we just want to thank Emily for taking the time. She is here with us because we're going to spend some time talking about adverse childhood experiences. And another way we're going to probably say that throughout the video so you don't get confused is ACEs. So let's just jump into this and just start with Emily first. Again, thank you for being here.
Thank you.
And let's just jump in. What are ACEs?
So ACEs, also known as adverse childhood experiences, are traumatic events that occur from our developmental years up until the age of 17. Really, this was a study that they did with individuals that had access to healthcare and looked at, what are some different factors that impact us developmentally. And it really started from nurses who had gone out and smoked after, a serious situation happened in the ED or whatever had occurred. And what they had found from this study is that regardless of having access to health care, being financially stable, having an overall, better life, because when you think of trauma, you typically think of people that are currently struggling. They found that they had more negative impacts with more traumatic events occurring, such as physical impacts and emotional impacts. So whether that be mental health, substance use disorders, this could be things like heart disease, obesity, more likely to smoke. So it's really impacted people later on in life.
Okay. All right. So what would some examples, so what would be some examples from a childhood that we would say this would be some typical ACEs that someone might have?
Okay, so when we have an ACE score, this would be 1 point. So an example of an ACE score during your developmental years would be maybe physical or emotional abuse, physical or emotional neglect. You have situations where there was substance use, misuse in the house. You have situations where maybe a parent was present due to incarceration, domestic violence is present. So it doesn't have to necessarily be something that happened to the kid, but something that the kid had witnessed.
Okay. So with that idea of what an ACE is what they've witnessed or what a child has gone through, and just kind of considering the current situations that we're in right now with COVID-19 and of course, things being shut down, uncertainty, there's probably a lot of stress and anxiety going on. I mean, you mentioned physical abuse or neglect, and I mean, there's a good possibility that, kids are going through that now, being at home and not at school. So I guess would we be able to consider this period of time connected with ACEs, or how does this relate? What's the significance between what we're going through now and with ACEs that we should be aware of?
So there's been a lot of thought about, how does this isolation impact, your childhood? And when we are around, we have kids and we're home and we don't have the ability to socially connect or be out and about as much, especially with kids not being in school, you have maybe some more emotional instability going on in the house. So you have a higher percentage of increase in chances of emotional neglect, emotional abuse, and worst case scenario, physical abuse, domestic violence being witnessed in the home. And that's just from that, isolating environment. It really impacts your mental health.
Okay. So definitely, I mean, so really a lot of kids might be coming through when this is all said and done. I mean, they might be those that then could say, well, now I have an ACE score. I mean, potentially didn't going in and potentially could after this just because of whatever traumatic experience they're going through, house by house almost. I mean, because it's really, this seems to be a very, we can't generalize everything. One house might be a little bit different than another, and some kids are really struggling right now.
Yeah, and that's why it's so important, what is the community going to do as a whole when we do start reintegrating back out into the community? So you will have circumstances and kids who have experienced ACE scores during this time, but we like to say, as an ACEs trainer, that doesn't mean if you have an ACE score that's your end all. It's really comes down to building resiliency in your community. So what do educators do when these kids come back to school? What kind of support systems do they have? What are different things in place that the kid feels that they have a trusted adult? And that's why these different resiliency building programs that we have in schools are so important. And that's why having, different connections, whether it be from the faith community or, grandparents or whatever it may be. And especially when you think of food desperation, food banks are definitely overwhelmed right now, especially with financial disparities going on. So what are some programs that, the Benton County community can have in place to ensure that these kids are taken care of and they have resiliency to balance out that ACE score?
And so I don't know if I'm completely correct in this, but it just kind of seems as you're sharing this and you're talking, and maybe some other people think this is when you really think about ACEs. I mean, there's so many different factors that could fit into. It's almost like this kind of a big basket of I mean, you think adverse childhood experiences. There's such a big basket there that a lot of us might not even consider what some people are going through and the impact that it's going to have. I mean, it's kind of like we see things through the lens of my family, and I kind of seem like, well, that's probably kind of close to what everybody else is going through. But the reality is, I mean, this is, I'm not trying to, get my thoughts. It just kind of, we don't know how a lot of this stuff's going to impact people. We don't know how it's going to impact kids and all of that. So I think that's important. I mean, as you kind of talk, yeah, it's a bigger scenario than I think a lot of us think about.
Well, and if you think about this, we currently are kind of having a response of, well, what are we going to do in the now because it's a crisis? But you need to think of the long-term impact of this. So what is social distancing going to look like? What is isolation going to look like for not just a period of 3 months, but 2 years? So we get a lot of different positive factors that come in with not only emotional connection, but physical connection. The simple hug, it builds some really positive things in kids. And when we don't have that, what is that going to look like? So it's really important to try to start brainstorming now, how can we build connections without being physically present or being, and just having a simple hug and that embrace and things like that.
Okay. I'm kind of thinking, for those that are watching, parents or maybe grandparents or anybody that, has interaction with kids that are in that window of time. I think it's great that we talk about what do we do after this is all passed, but then there's also what can we do right now? And I guess one of the thoughts that's kind of going through my head is this is a time where as parents or grandparents again, or aunts and uncles or whoever, that if we have a child that, that we're around or we're investing in, I think it sounds like just even having some age appropriate but blunt conversations about kind of what's going on. I think it'd be easy for us to focus on how this is impacting us as adults, and we can kind of forget that the child's going through it with us. So I guess I don't know if you want to speak into that, but I guess I'm kind of just sharing, brainstorming my own thought is we as adults also need to remember these kids are going through this with us, and I think it would be wise of us to have maybe some focused conversation about stuff and actually speak into them even now instead of letting them kind of linger in whatever they're facing themselves. I mean, that's kind of a thought.
Yeah. I mean, myself personally, I'm a huge advocate of educating and awareness versus shielding the child from different things. I think that when you start with a foundations at an age appropriate level of educating about what are germs, how do you socially distance, what are emotions, how do you feel when certain things happen. I have a kid at my house, and with her we talk a lot about germs, and she has had questions of like, why am I not at school right now? And it's like, people are getting sick, that's why we got to be safe, we keep our hands in our pocket, and doing different types of things so that she is aware and not scared.
Yeah. Yeah, and one of the things we're doing in our house, I mean, we of course have the conversations of, the sicknesses and all that stuff that's going on. The other thing that we've done, just kind of again that positive factor is we've started to have our kids. We try at least every week for them to sit down, and they've been making cards for older people that we know that we can send to them, mail to them, and to just because the ideas of that isolation thing, it's like teaching our kids also this positive factor of it's really easy to focus on the negativity for ourselves, but sometimes just trying to be a encouragement to other people kind of makes it. I was really, not to get personal, but like last night I was really encouraged because my daughters did that, and they got this like long letter back from one of the elderly
Oh.
people that they sent with all these questions, and I was really impressed. My daughter sat down with that letter and she wrote like this extremely long letter back. Like, so I mean, I even think about as parents, maybe we should think of stuff like that. How do we start having those conversations, but also encouraging our kids to, we can strengthen those positive factors in them during this
Well,
time.
yeah, and it's an opportunity for more, family time building. We focus on like, oh, I'm overwhelmed, I'm at home, and those circumstances are important. But when you think about, the activities that you're doing with your kids, I know that at my house, we've been really getting into baking when she's there, and doing different art projects and things, now we're doing gardening, things that we wouldn't have had time to before. And I think that's why it's so important to really look at the positives, like what kind of emotional connection can you build with your child at home, and how can we connect with the community. So you think of the intergenerational things that are going on. So your kid is able to connect with an older adult that she might have never had a connection with. And what kind of wisdom and knowledge can this older adult provide her? And vice versa, like what's going on at home.
Yeah, no, that's great stuff. One of the things I want to hit on just for a moment is just this week during the governor's press conference. One of the things they did talked about was, of course, because of the rise in stress and anxiety and everything that's going on, and there was the concern over, you got kids at home now, parents that might be off work, and everybody's in the house together, and some people are maybe loving that, and some people love it, but they're getting a little at their breaking point, they might feel. So one of the concerns was, of course, some of those safety mechanisms for kids is gone going to school. If they're in a home where there's possibility of some of that domestic violence or abuse or neglect, and they've kind of now, because of social distancing, they don't have that safeguard to go to the doctors or that kind of stuff. So I mean, I don't want to put you on the spot, but just if we can converse a little bit, like we don't have like the major answers, but I mean, what are some resources that you know of, or maybe just some suggestions of if a parent's watching this and they're just kind of like, I'm stressed, like I'm just getting stressed. I love my kids, but I'm getting to the point where I'm finding myself to be short, and my fuse is not there, or even talking about ASAC in the sense of I'm drinking a few more glasses of wine every day because I'm trying to cope. I guess my thought would be is, can we speak a little bit about just maybe some resources out there that people can go to, or just some thoughts of trying to process through this stuff that maybe you've run into, or just some ideas that you have when it comes to that?
I think in terms of being a parent or, influential adult in a child's life, and you're feeling that sense of overwhelming, I'm getting short. I think we have this mentality that I always have to be strong for my child, and it's okay to take a step back and be like, I'm not the perfect person to be in this situation right now. Who do I trust in my life that would be okay to switch me out, even if it's for a couple of hours, so that you can, obviously from a social distancing safe perspective, go to the grocery store, or even just, go garden in your yard, or whatever it may be, go on a walk. There's a lot of research that shows just simple going on a walk for 30 minutes boosts your mental health, so that you can come back to the situation and be ready for that. I think in terms of substance use disorders, ASAC services are still up and running. We are asking that you call and then make sure that you don't have any symptoms of a fever or cough or things like that. But we are still taking people for assessments. We're doing telehealth and things like that. We have different mental health providers. So whether it be Tanager Place that offers services to children, they're still doing different telehealth BHIS services, whether it be the Abbey Center with adult mental health providers. There's always the Above the Influence Coalition for Benton County. We have a lot of people at the table that know a lot of people and have a lot of resources. So just simply reaching out and saying, hey, this is a circumstance, and we can give you different outlets. There's a lot of different things present in our community that we have access to.
And while you're watching this video, I mean, we are going to put the information, especially like ASAC's number, so people can call. We want those resources to be available to anybody. But I think a big message there is we shouldn't try to do anything necessarily on our own. It's okay to ask for help. And I think that's maybe one of the messages also of ACEs is sometimes when it comes to ACEs, the more I've learned about it, we kind of carry those maybe in silence. It's really easy to even if we don't know they're ACEs, we kind of carry the bad stuff or the negative stuff or the stuff that we feel is more of a burden. We can carry that in silence, or we can carry that individually. And I think maybe through this whole situation, it's teaching us, don't try to do it on your own, right? Use resources, ask for help. Sometimes just have that conversation with somebody. So I would echo that, when it comes to ASAC, especially substance use disorders, if you just need to talk to somebody, sometimes it's just good just have that conversation, to be able to get some stuff out. So I think that's great, and I think that's kind of a message that I would take away from that also. Just use the people around you. Try to, and if you have to hunt for it, even if it's call the church, call a church. And
Call the faith community.
Call faith community, yeah, we might be able to get connected with people we never thought possible before, so.
And, our different agencies and organizations and entities have been so resilient during this time. You have to think it went from, oh, this is something that might be occurring to everybody please stay home and businesses shut down. And now you have faith community going online and still offering that spiritual message. You have even the 12-step recovery community, mutual aid meetings, doing everything online and having those resources. So in terms of ASAC, doing telehealth, things that we've been able to accommodate so that people can still receive services. And we've actually seen some positivity in being able to access these online services, is that people who had transportation limitations or, maybe they have different situations, mental health diagnoses or anxieties that occur that make them very nervous to come into a group setting or be there one-on-one. They now have that ability to do that.
And the thought that just went through my head with that statement is those mental health issues that made the anxiety to go, those could be attributed to ACEs from their childhood. We kind of look at people as adults sometimes and be like, well, why do you see it that way? We don't know what they went through as experiences, and we don't know how that's helped shape the way they see the world and the way they see themselves even. And so I think that's important for us also as we have this conversation, just to say, we kind of say, we don't know what somebody's gone through until we walk in their shoes. Well, I think ACE is a great example of that. We don't know.
The best message that I've always taken with me through my professional career was a therapist at Tanager Place who said to me, everybody experiences trauma differently. And so, because you would have these stressful situations. So maybe you do have a kiddo at home that does have, mental health diagnoses, whether it be ADHD, ODD, and being able to recognize like, okay, this kid might be having this trauma. It's the same type of trauma as this other kid, but different behaviors associated it. So that's really impacted me in the long term is you can have somebody that's very outgoing as an adult, but have a higher ACE score. And I think that's one of the biggest components of ACEs is that people who work in positions as nurses, as first responders, and these different types of things typically have higher ACE scores because they grew up in a time where it's chaotic and unsure. So their resiliency was to be able to work with people in crisis situations and do different things.
Yeah, that's really good. That's really good. The example that goes through my head is just taking two kids that bullying, being an ACE, and one kid could be bullied and use that as that resolve to try harder and become some, and really dig into what they're striving for. And another kid might experience bullying and it really affects them and makes them really doubt themselves. And like you said, same situation, but each person processes that and goes through it differently. So It's really, it's bad for us sometimes, I would say, to kind of, well, I went through that and this is how I handle. Well,
Yep.
other people handle it a little bit different. So that's a good reminder for us. Well, I guess before if we get done, I mean, do you have any other additional things that we haven't covered that you feel are important that we want to get out there, or you think?
I think the leaving message is please reach out. It does not make you a weak person, and it does not make you a soft person to say, I'm struggling right now, I need help. There are so many people in the community that are empathetic and understanding and might have gone through or are currently experiencing a certain situation. And please, please, please reach out. Find somebody. What I educate students, one of the biggest things I say is find a trusted adult that you can really rely on when you have uncertainty in your life, and it doesn't necessarily can be a parent. And when I educate teachers, I say, be the adult in that child's life that they can rely on and really lean on in troublesome times.
That's good. That's a good reminder that, I mean, it's easy to forget stuff like that, you know, when you're in the middle of something. So what we're going to do at the end of this video, I just want to encourage you to, we're going to have some information at the end. One of the pieces of information we'll have is some contact information. If you want to connect with us as a coalition and what we're doing here in Benton County, we'll have some information about ASAC and the services that they have. But at the same time, learning about ACEs and hearing this, if you listening to this are intrigued by ACEs and want to know more, or you think this is something you would want some training on or more information on, we'll have some contact information at the end of the video also, so you can reach out, because this is a topic that we want to get out there as much as possible for people, not just in the professional field, but just general population, because this impacts all of us, and getting a better understanding of ACEs can help you as a boss, employer, or as a parent or a grandparent or a coach, whatever it is, as you're working with not just kids but also adults. Having a better understanding of ACEs can also help you have a better understanding of where people are as adults, and possibly what they went through, and the ACEs that they have. So pay attention at the end of the video and use those resources as you can. But I want to thank Emily again for
Thank
coming
you.
to us. We appreciate the time, and hope you have gained some good information and knowledge through this video. So have a great day.